Now we will be starting with a new series of videos, short videos about the questions of the day. And these questions will be some of the questions which have been lately asked. So one important clinical entity which has been asked lately is the Eagle syndrome. And as far as this Eagle syndrome is concerned, what and why was it asked? Neet PG, FMGE and MCH head and neck surgery. So what is important about this thing is that you are already aware of this important spicule of bone, a pointed projection from the posterior part of the base of the skull, which is given the name as styloid process. Styloid process are present in various bones in the body, but this is one important area over here. So you are well aware of the skull, and over here this is the spicule of the bone which is given the name as styloid process. Behind the styloid process lies the mastoid process, which is important from an ENT viewpoint, and this is the external auditory meatus, external acoustic meatus, which you are aware of. Now what sometimes happens is that this styloid process is a bit more prominent, a bit more elongated, or it presents so as that normally it is not palpable, but in case it is elongated, whether unilaterally or bilaterally, it can be palpated in the tonsillar fossa as well. So that's a very important point you have to take into consideration. And what is the clinical significance of this elongated styloid process? The importance of this elongated styloid process is that there are some important structures which lie within the vicinity of the styloid process. And as far as the styloid process is concerned, the internal carotid artery lies near the tip of the styloid process, and the facial nerve lies in relation to the base of the styloid process. There is the stylomastoid foramen present just posterior to the styloid process, and the facial nerve lies in relation to the stylomastoid foramen. So once this elongated styloid process is present there, it can present as a clinical entity in the form of a patient having headache, or a patient can present to the dental surgeon with earache or pterygia, or it can sometimes present with difficulty in swallowing, and sometimes it can present in a more serious fashion in the form of TIA, transient ischemic attack, or in certain cases in a more severe form in the form of a stroke. And what is the reason is that this elongated styloid process can compress especially the internal carotid artery, and the patient can present with stroke, a cerebrovascular accident. So the clinical manifestations can range from simple headache to otalgia or severe stroke. That is the importance of the elongated styloid process. And what is important about this, it might sometimes be given as a image, and as you can see in the image over here, this is an image which shows bilaterally elongated styloid processes, and this clinical entity is given the name as Eagle syndrome. It is also sometimes given the name as stylocarotid syndrome once it compresses the internal carotid artery and causes the manifestations I just enlisted to you. So this is important about the styloid process. Sometimes a question may be further asked in your super specialization about the various important things which are attached at the styloid process. The styloid process gives attachment to multiple muscles and multiple ligaments. The ligaments to which it gives attachment is the stylohyoid ligament and the stylomandibular ligament, and it also gives rise to styloglossus muscle, stylohyoid muscle, and the stylophalangeus muscle. And as far as this styloid process is concerned, then it is given the name as styloid apparatus, because it is a whole sort of apparatus having a bony component, having a cartilaginous component having a muscular component. And as far as the embryology is concerned, you are well aware of the pharyngeal arches, and different components of the styloid apparatus are derived from different pharyngeal arches. So this is something which you have to remember about the Eagle syndrome. Thanks a lot.